طلاب الكل شايفين الباوربوينت ظاهر بالنسبة لكم؟
نعم.
اوكي. إذن let me start. Lecture on the series of CNS pathology or central nervous system pathology. أخذنا brief introduction in the practical session, and let me continue talking about diseases of the central nervous system. واتفقنا إنه the nervous system is composed of, it is just a flashback brief summary into the central nervous system and peripheral nervous system. The peripheral nervous system is composed of the autonomic and somatic component, and the central nervous system composed of the brain and the spinal cord with the covering what is called the meninges. واتفقنا انه المننجز قسمناها from outside in dura mater, الارachnoid والبايا mater. طبعا الديورا ماتر هي الام الجافيه فهي تكون external، والبايا بروكسيمال هي تكون الام الحنون، الترجمه مالتها الام الحنون. وقلنا ممكن تحفظها بكلمه باد اللي هي بايا ماتر ارachnoid and ديورا ماتر. وابتداء تحدثنا عن الcongenital anomalies which is called the developmental disorders of the central nervous system. Central nervous system, and I talk about neural tube defects. Neural tube defects هي عبارة عن group of disorders, not a single disease, group of disorders characterized by failure of closure of a neural tube. Failure of closure of neural tube during development of the baby. طبعا لاحظوا انه deficiency of folic acid lead to increased incidence of a neural tube defect. By what mechanism, it is still not known, although there is numerous animal studies and observational studies. There is no exact mechanism elucidated for the why folic acid involved in neural tube defects. طبعا فد ملاحظه انه النيورال تيوب ديفكت تحدث as early as early pregnancy يعني early weeks of pregnancy even before the mother knows that she is pregnant. واضح؟ يعني لا زالت المرأة ما تعرف انه هي حامل وصاير نيورال تيوب ديفكت. لذلك الافضل ان نبدي الفوليك اسيد supplementation early and even before pregnancy. وهذا الجروب of disorders which is characterized by failure of neural tube closure could be classified according to the site of defect into either anencephaly characterized by failure of anterior part, and as the name implies, an معناها absence, cephaly معناها brain. There is incomplete absence of a brain. الحقيقة the frontal part of the brain is absent. There is frog-like appearance of the head، يعني يشبه الفروغ، يشبه الضفدع مثل ما شفنا الصور بالعملي. Anencephaly in general is incompatible with life. Incompatible with life يعني عادة affected fetus died. When there is posterior defect, what is called spina bifida occur. Spina bifida have certain subtypes range from mild to more severe. Mild spina bifida called spina bifida occulta. Occulta معناها hidden. In spina bifida occulta there is only vertebral arch defect without herniation of either brain or the meninges. There is no herniation of spinal cord or meninges. There is only bony defect in the vertebra. The covering skin of the spina bifida occulta may present as a dimple with a tuft of hair. يعني ممكن يشوف a group of hair يعني مجموعة من الشعر on the overlying skin, the skin overlying the defect, the bony defect. And Spina Bifida subtype meningocele, seal معناها sac. فmeningocele there is herniation of meninges without spinal cord. In case of myelocele, there is herniation of the spinal cord. Myelo, the prefix myelo indicate spinal cord. Myelocele indicate herniation of the spinal cord without the meningeal coverings. Meningomyelocele refer to combination herniation of both the meninges and the myelocele. يعني اعذروني انا مضطر ان ارفع موقف الحضور. يعني عددكم 63 من اصل 136 63 طالب فقط اللي حاضرين وانا مضطر ارفع الموقف كما هو. Okay, let's continue our lecture. إذن the spina bifida could be either occulta, there is just defect in the vertebral arch, there is a spina bifida. Subtype meningocele, there is herniation of the meninges. بالإضافة طبعا شلون صار herniation of the meninges معناها أكو bony defect. In case of myelocele, there is bony defect with herniation of the spinal cord without meninges. And meningomyelocele, there is bony defect with herniation of the meninges and the spinal cord. There is another type of neural tube defect, which is not appearing here in the slide, which is called encephalocele. وشفنا عليها صور بالعملي. الانسفالوسيل بالمناسبة طبعا اكو بعض المصادر بعض الاساتذه يلفظونه encephalocele. Both are correct. Whether you pronounce it with S or K, encephalocele or encephalocele, both are right. Encephalocele, as the name suggests, there is defect in the cranium. There is herniation of the brain into a sac. Encephalocele, there is defect in the bony structure of the skull, يعني, with herniation of the brain. Let us talk about CNS infection of the central nervous system. As simple as this, infection of the central nervous system may involve the coverings, the meninges, or the parenchyma, what is called encephalitis. From where the source of infection of the brain? يعني منين تجينا infection of the brain? Here, this slide shows simple classification of the CNS infection into meningitis, inflammation of the meninges. طبعا بنقول leptomeningitis والother part هو الباتشي meningitis. Leptomeningitis is more common than patchy meningitis. Inflammation of the pia and the arachnoid. Encephalitis indicate inflammation of the brain. Myelitis, inflammation of the spinal cord. And localization of infection into abscess called brain abscess or cerebral abscess. What is the root of infection? يعني منين تجي الانفكشن into the brain? It is either hematogenous blood-borne infection ممكن from the lung, ممكن from endocarditis, ممكن from infection anywhere in the body could lead to bacteremia with lodgement of infection into the brain causing CNS infection. direct trauma such as physical trauma يعني car accident ممكن تسوي لنا fracture laceration of the skin or penetrating injury and direct implantation infection, or maybe during surgery or any surgical procedure involving the central nervous system could lead to infection. يعني مثلا احنا during lumbar puncture لما ناخذ sample of cerebrospinal fluid، اذا ما راعينا الاسبتيك تكنيك، اذا ما انتبهنا الى التعقيم، ممكن احنا we introduce bacteria into the central nervous system, to the meningeal space, leading to central nervous system infection. Infection of the air يعني adjacent infection ممكن يسوي extension leading to such as sinusitis. ممكن sinusitis تؤدينا إلى central nervous system infection. The least common mode of acquiring infection is the axonal transport through the axons of the nerve. This is occur in rabies and herpes virus infection. This is uncommon type of infection. The most common is blood-borne hematogenous type. إذن اتفقنا إنه infection of the central nervous system could be either meningitis, encephalitis, myelitis, or brain or cerebral abscess, and these infections comes from the blood, bacteremia. Infection from anywhere in the body could lead to dissemination of infection and reaching the CNS, leading to infection. Direct implantation by trauma or by surgical procedure, even minor procedures such as withdrawal of the central cerebrospinal fluid. Extension from adjacent focus such as sinusitis or otitis media could lead to CNS infection, and the least mode of infection could occur through transport along nerve axons, and such as occur in rabies and herpes virus infection. This slide simply give more details concerning the mode of CNS infection. Here you can see how infection colonized the nasopharynx, especially after preceding viral infection, which lead to lowering of immunity, followed by bacterial infection. From the mucosa to the blood, to the breaching the blood-brain barrier, reaching to the CNS. Let us talk about meningitis. Meningitis as simple as this by definition. مثل ما اتفقنا السيستم مالتنا نبدي definition, cause and effect. Meningitis is inflammation of the meninges. Inflammation of the meninges. طبعا هنا ليش ما قلت infection of the meninges؟ حقيقة sometimes irritation or chemicals could lead to meningitis rather than a microbial infection. ومثل ما اتفقنا, just I said that inflammation of the dura, meningitis involving the dura called patchy meningitis, وmeningitis involving the leptomeninges اللي هي البارا-arachnoid called leptomeningitis. وهذه الملاحظة اللي ذاكرها لكم خلوها ببالكم. يعني إذا ما قلنا حددنا إنه patchy meningitis أو meningitis of the dura, فمن نقول meningitis نقصد بها leptomeningitis. So we specify or not, يعني إذا قلنا leptomeningitis أو فقط meningitis, we refer to inflammation of the pia and arachnoid. هنا نتفق طلاب، يعني احنا شلون ممكن نسوي كلاسيفيكيشن؟ ممكن اسالك بالامتحان what are the types of meningitis. بعدنا نتحدث هسه عن المننجايتس. فالكلاسيفيكيشن ممكن يشمل التايب اوف مايكرو اورجانيزم into viral, bacterial, fungal and parasitics. Viral meningitis هي uncommon و involve enteroviruses such as mumps, herpes. ممكن يعني تشمل غير ال different types، يعني غير الانتيروفيروسز ممكن يكون عندنا الهربس، الميزلز، الانفلونزا viruses and the mumps. Different types of viruses. Bacterial meningitis تكون more common than viral meningitis. والmicroorganism differ according to the age. وتشمل Neisseria meningitidis, المنينجوكوكاي or meningococci, Haemophilus influenzae, streptococci such as Streptococcus pneumoniae or group B streptococci. Fungal infections include histoplasma and cryptococcus. Parasitic infection such as amoebic meningitis. إذن لما أسأل types of meningitis ممكن تقول لي according to the microorganism it is classified into viral, bacterial, fungal and parasitic. According to the anatomy, it is either, we just said, it is either patchy meningitis, which is inflammation of the dura, وقلنا هذه less common, والmore common هي inflammation of the pia and arachnoid اللي هي leptomeningitis. إذن صار عندنا طريقتين for classification of meningitis according to the type of microorganism, viral, bacterial, fungal and parasitic, and according to the anatomy اللي into patchy meningitis and leptomeningitis. Meningitis could be classified into aseptic and septic. Aseptic meningitis, لاحظوا الفرق هو فقط الأي. Aseptic meningitis is caused either by viruses or by lymphoma or leukemia. This is aseptic meningitis. Septic meningitis caused by bacteria. Septic meningitis is caused by bacteria. إذن هسه صار عندنا 3 modes of classification of meningitis according to causative microorganism, to viral, bacterial, fungal and parasitic, according to the anatomical site of involvement into patchy meningitis and leptomeningitis, and according to whether it is caused by bacteria or by viruses or secondary to lymphoma and leukemia into aseptic meningitis and septic meningitis. Again, ممكن نسوي classification للmeningitis according to the duration of infection into acute and chronic. If it is more than 4 weeks نسميها chronic meningitis. و if less than 4 weeks نسميها acute meningitis. Here, classification of the causative microorganisms according to the age. Escherichia coli and group B streptococci is the most common cause of meningitis in infants. Haemophilus influenzae is the common cause of meningitis in older infants and kids. Neisseria meningitidis seen in young adults, while Streptococcus pneumoniae in elderly. in elderly. هذه ممكن تجي لك سؤال بالامتحان على شكل multiple choice questions. The most common microorganism causing meningitis in infants is. وأنطيك الخيارات. وممكن أسألك enumerate or mention the causes of meningitis, type of bacteria causing meningitis according to the age of the patient. How a patient with meningitis present to you. يعني شلون تعرف هذا البيشنت عنده meningitis. There is fever, headache, neck stiffness, and altered consciousness. Altered consciousness. من أقول decreased or altered consciousness يعني ممكن البيشنت يجي drowsy وممكن يكون comatose. ممكن يكون comatose. يعني ممكن يكون فاقد للوعي وممكن الانتباه مالته زين الكونشسنس يكون قليل. Fever, headache, neck stiffness and decreased level of consciousness. طبعا اكو ساينز اخرى هذه راح تاخذوها بالميديسن وبالبيدياتريكس. This is the most common mode of presentation of meningitis. What is the complication of meningitis? The complications of meningitis include طبعا حتى لا تدرخ احنا قلنا ايتس معناها انفلاميشن. ايتس معناها انفلاميشن. فترجع مثل ما قلت لكم اذا تضبط الجنرال باثولوجي راح تضبط السيستميك باثولوجي. واحنا ايتس معناها انفلاميشن. there is bacterial inflammation وقلنا هذه تسوي لنا suppurative pus forming inflammation. فجروسلي شنو راح نشوف؟ جروسلي مثل ما شفنا الصور بالبراكتيكال there is pus purulent exudate covering يعني تتذكرون الصوره لما رفعنا المننجز شفنا البرين سيرفيس covered by purulent exudate. This is the gross appearance and microscopically راح نشوف neutrophil inflammation, neutrophil infiltration. فالcomplication ممكن تؤدينا الى scarring due to fibrosis and hydrocephalus وحكينا على الهيدروسيفالس بالعملي وراح ناخذه هسه في نهايه المحاضره. ممكن تؤدينا الى mental retardation يعني تخلف عقلي impaired level of intelligence. ممكن تؤدينا الى seizures اللي هي convulsions يعني epilepsy الصرع. وfocal cranial nerve deficit هذا الديفكت يعتمد على site of involvement يعني ممكن السمع يتاثر ممكن البصر يتاثر different mode of presentation according to the site affected. طبعا البايوجينيك انفكشن ممكن تؤدينا الى vasculitis inflammation of the blood vessels and obstruction with hemorrhagic infarct. من يصير blood vessel obstruction راح يؤدينا الى infarction. ولocalization of infection called brain abscess. Localization of pus called brain abscess or cerebral abscess. And طبعا in severe cases death may occur. نفس الكونديشن in case of acute inflammation. Acute inflammation anywhere will lead to either of these complications. طبعا الفيرال meningitis تكون more mild than bacterial meningitis وعادة resolve without complication except in cases of there is meningitis and encephalitis together. Death and complications may occur. طبعا بالاضافه الى الكلينيكال ساينز اللي شفناها for diagnosis of meningitis again we can withdraw specimen of CSF fluid, and we look for presence of neutrophil مثل ما شفناها بالعملي أو lymphocyte. يعني الليمفوسايت الماكروفيج مونونيوكلير سيلز نشوفها بالتوبركلوسيس بالفنجل انفكشن وبالفيرال انفكشن، بينما النيوتروفيل نشوفها بالبكتيريال انفكشن. There is increased protein and reduction in the glucose. Reduction in the glucose. مورفولوجيكلي شنو راح نشوف؟ طبعا بالمناسبه يعني بالامتحان يعني من اسالك مورفولوجي، مورفولوجيكال فايندينجز، باثولوجي، باثولوجيكال فايندينجز، جروسلي، هيستوباثولوجيكلي، مايكروسكوبيكلي، ماكروسكوبيكلي، هذه كلها المصطلحات تعني the same question, the same entity. في in case of pyogenic meningitis من اسمها pyogenic purulent suppurative pus forming. لاحظوا طلاب هذه الأربع كلمات pyogenic purulent suppurative pus forming the same. راح نشوف pus covering the surface of the brain، ومايكروسكوبيكلي راح نشوف neutrophils within the subarachnoid space. There's a neutrophil infiltration. In viral meningitis, there is lymphocytic infiltration. And as inflammation anywhere in the body, there may be mild edema. طبعا الإديمة بالبرين تختلف عن any site in the body، لأنه كل السايتس in the body, any organ in the body could tolerate certain extent of edema. يعني اللنج إديمة أو leg إديمة الإفكت مالتها clinical impact يختلف عن the impact of brain edema. ليش؟ لأنه the brain contained in a rigid case. البرين وين موجود؟ موجود داخل السكال، والسكال ريجيد ما تسمح بالاكسبانشن، فمن يصير brain edema اكو risk of herniation and death. واضح؟ يعني السبيس اللي موجود به البرين ما يسمح ب too much edema، بخلاف ما شفنا باللانج or leg edema or liver edema. any organ could manifest edema, but the clinical effect is much milder than, less drastic than CNS or brain edema. وهذه طبعا البرين edema راح ناخذها بالفاسكولار disorders in details. Localization of infection called brain abscess. Abscess is defined as the localized collection of pus. Where here you see that streptococci and staphylococci are the main causative organisms of brain abscess. And here you can see the source of infection in case of abscess. There may be localization of infection. يعني ممكن عندنا meningitis or encephalitis, then extension of infection from the meninges to the brain with localization and formation of abscess, localization of pus. Again, there may be from oral flora, from adjacent such as ولأنه الانفكشن تكون localized withdrawal of cerebrospinal fluid and examination is fruitless because the CSF is sterile. There is no extension of infection and spillage of inflammatory cells into the CSF. مثل ما اتفقنا الانفكشن ممكن تكون hematogenous originating from either adjacent or non-contiguous site. يعني ممكن ناخذ انفكشن من اللنج، ممكن from the heart in case of infective endocarditis، or any infection elsewhere in the body. Here, more details concerning the brain abscess, and as you see, the site of abscess differ according to the source. According to the source of infection. والabscess ممكن يكون either single or multiple. In case of bloodborne infection, the abscesses are multiple. There is brain edema. And heavy neutrophilic infiltrate. The pus localized and surrounded by necrotic tissue. والابسس ممكن يصير برupture to involve the ventricles. ممكن نشوف البيشنت brain abscess، يعني شنو ممكن نشوف general features of meningitis and encephalitis اللي هي الهيدك والفيفر، nausea وvomiting. ممكن نشوف altered level of consciousness، drowsiness, confusion, and ممكن نشوف convulsion. وقلنا impairment of involvement of cranial nerves may lead visual or auditory impairment. يعني هاي symptoms according to the involved part of the brain. General features هي الهيدك والفيفر والvomit. Encephalitis or encephalitis is inflammation of the brain. طبعا طلع بعض التفاصيل اللي تتعلق بالمننجوكوكال انفكشن والفيرال انسفيلايتس، هذه كلها راح تاخذوها بكورس المايكرو. زين، يعني الايم اوف lecture هو to present the pathological aspects. Details about the microorganisms are tackled in the microbiology lectures. Meningitis could be either involving the infection of the central nervous system, could either involve the meninges alone or the brain and meninges, and called meningoencephalitis. Different viruses could cause encephalitis. Histologically شوف perivascular mononuclear cell or lymphocytic infiltrate, and what is called neuronophagia. Neuronophagia معناها phagocytosis of neurons by macrophages. Phagocytosis of dead neurons or infected neurons by macrophages. glial nodules هي عبارة عن aggregate of glial cells at the site of severe infection and damage, necrosis of neurons. إذن encephalitis usually viral while meningitis usually bacterial. والبكتيريال من أسألك على المورفولوجيكال signs هي المورفولوجيكال signs similar to inflammation anywhere there is pyogenic infection grossly and microscopically. Grossly راح نشوف pus covering the surface of the brain, microscopically راح نشوف neutrophil infiltration and edema وcomplication of bacterial meningitis similar to bacterial infection and inflammation, acute inflammation elsewhere. Viral meningitis could be caused by arboviruses, by herpes, by cytomegalovirus, and else. Where histologically there is a glial nodules, aggregate of glial cells at the site of necrosis. There is perivascular lymphocytic infiltrate and neuronophagy, phagocytosis of neurons, dead affected neurons by macrophages. لما أخذنا اللنج tuberculosis, pulmonary tuberculosis, قلنا the natural cause of tuberculosis could lead to miliary tuberculosis. Miliary tuberculosis, dissemination of tuberculosis to involve different sites in the body. Different sites in the body, which is usually occur at later age, لما patient become older with lowering of immunity, miliary tuberculosis occur, and one of the organs that could be affected by tuberculosis is the meninges, leading to tuberculous meningitis. طبعا tuberculosis caused by Mycobacterium tuberculosis. While in HIV infected patient, the AIDS patient, it is caused by Mycobacterium avium intracellular. Grossly شنو راح نشوف؟ راح نشوف there is thick exudate, and the granuloma is the classical lesion of tuberculosis. It is about 1 to 2 millimeter in diameter, grayish white necrotic friable lesion. Macroscopically راح نشوف inflammation and granuloma, tuberculous granuloma, with or without caseous necrosis. يعني ممكن نشوف caseous or non-caseous granuloma with Langerhans giant cells. Then the source of tuberculous meningitis هو dissemination from the lung in miliary tuberculosis. In AIDS patients, there is infection with Mycobacterium avium intracellular. Grossly ممكن نشوف thick exudate وممكن نشوف the granuloma. Microscopically راح نشوف الجرانيولوما, which is either caseating or non-caseating with Langerhans giant cells. إذن لما أسأل شنو الكوزز of meningitis أو CNS infection, أخذنا الفيرال وأخذنا البكتيريال وتحدثنا عن التوبركولاس meningitis. CNS trauma. طلاب تاخذون استراحة وبعدين نكمل؟ أعتقد الأفضل إنه تاخذون استراحة. أوكي، أخذ استراحة طلاب ونرجع later on نكمل المحاضرة.